begin to drift south and eastward. The central and eastern parts of Kansas will very probably be cloudy in the morning, and then western Kansas will begin to get increasing cloudiness by tomorrow afternoon. Today, however, very, very pleasant reading. 73 up in the Goodland area, 72 at Garden City, 70 reported by Dodge City and Liberal, 72 over by the good folks of
Hello, and welcome to the first installment of PhysioDisc. My name is Andy Finley. I am a physical therapist and a mediocre disc golfer. The whole purpose of this video series is to bring about some information to the disc golf community about disc golf related injury, about rehabbing those injuries, about identifying those injuries, and about identifying ways to prevent those injuries from happening again. I've done a lot of listening to podcasts, I've done a lot of reading of online forums, and I've come to a couple conclusions. One, there's some okay information out there about injury on some podcasts. I've heard some thoughtful things said. As far as forums go, there's some really bad information out there. There's some really bad misinformation being spread about certain injuries. And the whole focus of this video series is to clear some of that up and to give you all a better idea of the standpoint of how someone who works in the health field views some of those injuries. As a physical therapist, how we would approach righting some of those injuries if possible. So if you hang in there with me, this first episode will be covering the most commonly injured tissues in disc golf and kind of what those look like. The first portion of this episode is going to be split into two. The first portion is going to cover injury to muscle, to tendon, and to ligament. The second portion would be covering your cartilage, your bone, and then a mystery tissue. We'll get into that. So if you hang in there with me, check out both of the segments of this episode. I hope to really be bringing you some helpful information. So the first tissue we'll talk about today is muscle, and there really are two types of injury that occur to muscle that could happen out on the disc golf course. The first is a strain, and then the second is a tear or a rupture, and there is an enormous difference between the two. And it's very easy to confuse a muscle strain with muscle soreness, for instance, that you may get when you exercise or you lift weights. But they are different, and we'll talk about those a little bit. And then muscle tears or ruptures are obviously the most severe form of muscle injury, and they each have various classifications. So they're different grades, and they have their own criteria. So we'll go ahead and take a look at those differences and classifications, as well as their expected healing times, and then what my recommendations would be in terms of how to treat them or how to rehab those.
So as you can see, that delayed onset muscle soreness can last up to 3 days. About 2 to 3 days is the normal span of pain with that, or discomfort with that. And that's actually just due to the trauma that you're putting directly on those muscle fibers. And that's actually good for new growth. But anything beyond that time period, we start to suspect a strain. And strains can last up to 2 weeks. They could last longer, depending on how you're going about healing. Maybe you're not rehabbing right, or you're not resting right, and those things can linger. In terms of tears, the grade 1 typically takes from 2 to 4 weeks to heal, and this increase in time is due to actual tearing of muscle fibers, and we're talking approximately 5% or less, and that's accompanied by decreased strength, endurance, decreased range of motion, some pain. Grade 2 tears can last up to 12 weeks, which is a good chunk of time, and a lot like those grade 1 tears, it's a result in just an increase in tearing of those fibers. With the grade 2 tears, you're looking at 5 to 99.999% of those muscle fibers being torn. As long as there's one little fiber intact, it's not a complete tear. I don't know how that would be possible, but that's just the range that has been determined. And with the grade 2 tear, you're going to have an excessive loss of strength, an excessive loss in endurance, and range of motion. I mean, it only makes sense that if that contractile unit, the functional unit of the muscle, is torn, then the muscle can't do its job. And finally, grade 3 tears. These are the worst of the worst. These are your ruptures. And these bad boys can take up to 6 months to recover from. and that is a result of 100% of those muscle fibers being torn. And these are usually accompanied by a lot of pain, a lot of swelling, a lot of bruising, and then you'll also have potentially a bulge or a lump under the skin where some of that muscle has kind of rolled up, and it's not pretty. It's not fun. Unfortunately, conservative methods like PT don't do the trick to heal this, and you're going to probably be consulting a surgeon to get that fixed. I have not seen this happen on the disc golf course, but that doesn't mean that it's impossible. If someone were to go out with a grade 1 or grade 2 tear, then they could definitely go out and get themselves a full muscle tear. That's not impossible, just improbable. Now, with anything above a strain, I'd recommend that you take the time off, allow that to heal, because you don't want to be sitting for 6 months waiting to get out there to just slowly start to build up to play again. It's not 6 months off from playing, but it's 6 months for that muscle to heal, and then you're going to be looking at months of recovery then too to get back up to your playing potential, your normal play.
Next, we're going to take a look at tendinous tissue or tendon injury. Over the past few years, there's kind of been this change, and I'll get into this a little bit more detail here in the next slide. But there's been a change in the way that therapists look at tendon injury. It used to be that we would diagnose folks with either a tendinitis, itis meaning some type of inflammation is present, or a tendinosis, osis meaning no inflammation. So there is a tendon injury, but it doesn't have any inflammation along with it. Now the current label is tendinopathy. Just another big word basically to describe that there is an injury to the tendon. But in a way, the tendinopathy encompasses both of those previous diagnoses. But we call them now a reactive and a degenerative tendinopathy. Let's say you're out playing around and you go and you throw a flick shot and immediately you feel pain on the inside of your elbow. That would be an example of a reactive tendinopathy. And like I said, we'll go into a little bit more detail here in a second. Or let's say you've played an entire weekend of golf. You played a big tournament, or maybe you've just gone out with your buddies and played 2 or 3 rounds. And sort of after the second day, or even by the third day, you're really starting to feel the wear and tear on your elbow from throwing so much. That would be more of a degenerative tendon injury, and kind of what we classically call an overuse injury. So let's go ahead and go to the slide and see what that has to say about those injuries, their healing times, and then what you have to expect.
Yeah, so as I just mentioned a few seconds ago, there's kind of been a change in the last little bit of how therapists think about tendon injuries. In the last couple of years, J.L. Cook et al. Came out with some research that said that tendon injury occurs in a continuum, meaning that it starts out as one form of tendon injury and moves to another more serious form. The first form is reactive tendinopathy, and this really just happens when you are not prepared, or the tendon is not prepared to take on some type of force. And it obviously, if it's not ready to take it on, it's going to injure the tendon tissue. And this will cause changes at the cellular level. And as time passes and you continue to use it, it just gets worse. It degenerates, which then turns into degenerative tendinopathy, the second form, the more serious form. And in this more serious form, the tendon is full of cell death. Apoptosis is what that's called. And then the other cells that are in charge of making new tendon tissue are just completely exhausted trying to keep up with all the cell death, and they just can't do enough work. And like I said, this is the classic overuse tendon injury. Rehab for a reactive tendinopathy is going to take 3 to 7 weeks when approached correctly. And it can be treated a number of ways. The best way to treat it is a decreased load or totally unloaded. Think tiny dumbbells or light resistance bands. And you're going to be working in hundreds of reps. Hundreds. The reason for the decreased load is to allow for that repair of those newly damaged tendons. You don't want it to get worse. And then the crazy number of reps is really just due to the absence or lack of blood flow or little blood flow to those tendons. You really want to get the good stuff there. So you're going to have to do a bunch of reps to make sure the blood is going there. And just do as many as you can. Degenerative tendinopathies, you're also going to treat those for about 3 to 7 weeks. But this is going to be a little bit different. They're going to be loading these tendons. So think about Arnold Schwarzenegger in his prime, like in Pumping Iron, not really, but you get the idea. You just want to heavily load that tendon, and then you're going to do a moderate amount of reps. We're not working in the hundreds, but we're doing quite a few reps. The idea behind loading a degenerative tendon is the thought that these tendon collagen fibers are all out of whack. If you were to cut a perfectly healthy tendon in half and you were to look at it from the top, it would be like looking into a newly opened box of uncooked spaghetti noodles. Think about all those little noodles just laying right up next to each other, nice and straight, nice and close together. If you were to cut an unhealthy or degenerative tendon in half, it would look like looking at a bowl of cooked spaghetti noodles. They're just all over the place. That's not strong. That's not efficient. So you really want to realign those collagen fibers. And the reason that we have such high reps, again, is because of the low blood flow. You got to get the good stuff there. You got to get it healed. So really make sure you're getting a bunch of blood pumped to that area. You can definitely continue to toss plastic with a tendinopathy. Yes, you can. You just may want to avoid any kind of movements that exacerbate your symptoms, make it worse. If you go out there and you're making it worse, that's a sign that you should not be playing.
Now on to our final tissue of this segment of the first episode, and that is ligamentous tissue. Yes, ligaments. They are somewhat similar to tendons in that they act as an anchor. They're responsible for acting as an anchor. Tendons anchor or connect your muscles to your bones, whereas ligaments connect bones to bones. They kind of keep those locked in and in the right position, right alignment. And also, much like tendons, your ligaments have a really low level of vascularization, which means they get little blood supply, which then means longer healing times, which is not ideal, I know, but that's just kind of the way it is, and we have to roll with those punches. And this is also really important to consider if you suspect you may have, or your doctor or a therapist has confirmed that you have a ligamentous injury. So let's go to the slide and discuss some of that now.
So as you can see, there's not a lot on this slide, and I did that for a reason. If you think you may have, or you've been told that you have an injury to a ligament, and you did it playing disc golf, or it causes more pain and problems while chunking, do yourself a favor, take the time off. I'm not trying to withhold information from you. You could easily just Google the information if you wanted to, and I'm definitely not going to stop you from doing that after you watch the video. Heck, you could pause the video right now and do that. But my personal opinion is if that you have a ligamentous injury, you need to be bracing it for extra support, and you need to be resting it for 8 to 9 weeks. Does that mean you can't go do anything with it? No, absolutely not. But the forces that you create when you're playing disc golf are generally just too great for those ligaments, especially if they're injured. And the last thing you want to do, much like a muscle tear, is go out with a partial tear and then fully tear it, and then you're going to need a year or more to heal up after surgical repair. And it's kind of foolish to think, well, Adrian Peterson, he came back from his ACL tear and started week 1 in just around 9 months. Well, he's an anomaly. He is a freak. He's a freak of nature. He was also in peak physical condition prior to tearing that ACL, and that's kind of a topic we'll talk about in future episodes. But he was not just in peak physical condition. It wasn't your peak physical condition. It was his, an elite NFL future Hall of Famer peak physical condition. There's a huge difference. So much like tendons, ligaments have a very low blood supply and will require a long time to heal and to heal fully and properly. So take the time off. Do yourself a favor. Thanks for watching the first half of the first installment of PhysioDisc. Now, make sure you go ahead and watch the next half where we go into further discussion of those other tissues. Look forward to seeing you there.